Nitroglycerin and aspirin are the two medications we're allowed to give for patients who are experiencing chest pain of suspected cardiac origin. That protocol is S-126 according to San Diego County. These medications must be prescribed to our patients in order to give it. Therefore, we don't carry it on the rig, and we cannot give the medications if they're prescribed to someone else. We assist in giving these medications. We do not administer these medications, meaning the patient has to be able to follow directions because we have to put the medication in their hand and they have to take it. The normal contraindications apply to these medications, such as the patients being able to follow directions and the patients needing to be able to swallow. There are more contraindications and more information that we're going to go into next. Nitroglycerin is the first medication we give to patients who are experiencing chest pain of suspected cardiac origin. The reason we give this one first is because we have to give it time to act before we reassess every 5 minutes. That's important because this medication is the one that we can give multiple times if our patient is not improving. This medication can be given 3 times according to Protocol S-126, but it has to include the doses our patient took previous to our arrival. So it's very important that you ask your patient, have you taken nitroglycerin today? Because if they have, you can give less doses. There are 4 contraindications that you have to list in order to give this medication. The first one, you have to ask your patient, have you taken any erectile dysfunction medications or sexual enhancement medications in the last 24 or 48 hours? The 48 hours is for San Diego County Protocol, the 24 is for National Registry. The acronym to remember these medications is Very Colorful Lover. Very stands for Viagra, colorful is Cialis, and lover is Levitra. So you need to ask your patient, have you taken any of those in the last 48 hours? They have to say no in order for you to be able to give this medication. You also have to ask, have you taken any pulmonary hypertension medication, such as Revatio, Flolin, or Velitri? The acronym to remember those is Red Flowing Vein. That one doesn't have a time limit on it because if they're prescribed that medication or they take it every day. They have to say no, they have not taken any of those medications in order for you to give nitro. The other 2 contraindications are vital signs. So the patient's systolic blood pressure has to be equal to or over 100 in order to give this medication. Therefore, the contraindication is if it's lower than 100, you cannot give this. The other one is heart rate. Their pulse has to be between 50 and 100 for us to give this medication. Therefore, the contraindication is if their pulse is less than 50 or over 100, you cannot give them nitro. When doing 5 rights, the right patient is the patient is prescribed this medication. Therefore, their name needs to be on the bottle and it has to match what they've told you their name is. We cannot give this if it belongs to somebody else. The right medication is nitro is a vasodilator. Therefore, it decreases the workload of the heart. The right dose is whatever the patient's prescribed dose is. So you ask the patient, what is your prescribed dose? According to this bottle, it's 0.4 milligrams. So you say, okay, correct dose is 1 tablet, 0.4 milligrams. The right route is sublingual, meaning they're going to put it underneath their tongue and let it dissolve. They're not going to chew and they're not going to swallow. That's the type of information you have to give the patient when you're going to give it. When you're instructing them, you say, put this under your tongue, don't chew, don't swallow. And then, of course, it's not expired. You're going to check it with your partner 3 times and then assist in administering this medication by putting it in your patient's hand and having them put it under their tongue. Now we're going to go on to aspirin. Aspirin is the other medication we're allowed to give to patients who are experiencing chest pain of suspected cardiac origin. Aspirin we can only give 1 time, and we can give it up to 350 milligrams. It's very important that you ask your patient, what dose of aspirin do you take? If they take 81 milligrams, you're going to give them 1 81 milligram tablet 1 time, and that's it. If they take, for example, 400 milligrams of aspirin, you can only give up to 350 milligrams. Therefore, we're going to give them 350 milligrams, even though their dose is 400. Keep in mind, previous doses don't matter. So if the patient took their aspirin before you got there or took their aspirin earlier today, it doesn't matter, you can give it anyways, as long as you only give it 1 time. Going into aspirin's 5 rights, right patient is the same as nitroglycerin, it's prescribed. Right medication, this is an antiplatelet aggregate, meaning the red blood cells become slippery and they slip off each other, so that way no more clotting occurs. It doesn't change the clot that's already there, but it doesn't make it worse. The right dose is whatever your patient's prescribed. The right route is oral, meaning you're going to tell your patient to chew and swallow the medication. And it's not expired. You're going to check it with your partner, and you'll check it one more time to make sure it's been checked 3 times before we assist in administering this medication. Just like nitro, we're going to actually place the medication in the patient's hand, give them instructions to put it in their mouth, chew and swallow, and that is the administration of aspirin.